Hi, my name is Dr. Olubukola Ayodele. I am a consultant medical oncologist. In this video, we'll learn about infections and how to avoid them while having your cancer treatment. We will also hear from Mariam, who will share her experiences of having infections during her cancer treatment. What is an infection? An infection is when harmful organisms such as bacteria, viruses, and fungi enter into the body. Your body normally is able to protect you from these organisms. However, with cancer and cancer treatments, the immune system isn't working properly, increasing your risk to infection. When your immune system isn't working properly, you need to treat these infections very quickly. Infections with bacteria can be treated with antibiotics. White blood cells help you prevent and fight infections. With cancer treatment, you don't make as many white blood cells, leading to an increased possibility of infections. Depending on the chemotherapy drug, you might experience infections between day 7 and 14 of your treatment. This is the time where these white blood cells are the lowest in your body. After this period, the white blood cells tend to recover before your next cycle of treatment. Some chemotherapy drugs can affect the bone marrow more than the others. In some cases, you are given antibiotics to help fight the infection. And in some cases, you might be given an injection that would help boost the bone marrow and the white blood cells. Some other treatments can affect your immune system, such as surgery, but these are less common.
Hi, my name is Mariam and I was diagnosed with Hodgkin's lymphoma in November 2020 when I was just 18 years old. I struggled quite a lot with infections during my treatment. During my chemotherapy, I'd end up with low blood counts and I'd have to go to the hospital and be hospitalised for days on end. I would have infections such as tonsillitis, chest infections, and also skin infections, and this was quite difficult for me to deal with. The team would usually check my bloods to find out exactly what infection I was having. I was then prescribed antibiotics and I'd only go home once my blood counts had gone back to normal. The doctors had also carried out x-rays and other measures to try and find out exactly what was wrong. The longest amount of time that I stayed in the hospital was 14 days, and this was because of an infection that the doctors couldn't figure out what was wrong. I think this made me feel extremely isolated because I was not allowed to see any of my family and friends. And when I was allowed to see family, I was only allowed to see one family member at a time.
If you had an increased risk of infection due to your low immune system, there are some tips that you can follow. Good hygiene is important to avoid infections. Wash your hands before cooking, after using the toilet, or after touching pets or animals. I would also advise that you take a shower every day and avoid sharing face clothes and towels. It's important to stay away from people who have an infection such as cough, cold, or tummy bug. It's important not to be in a bubble. However, if you're going into crowded spaces like the shopping mall or using the public transport, you can use a face mask or use sanitizers for your hands. Also, regarding swimming, avoid when it's overcrowded. If you need to work, it's important to have a discussion with your employers about reasonable adjustments to make sure that you're working in areas that are not overcrowded, or even work from home if possible. It's important to drink a lot of fluid. This allows your mouth to be moist and healthy. It also flushes your kidneys and your bladder that prevents bacterial infection. It's important to maintain a healthy, balanced diet during your treatment as it helps to improve your immune system. You should have food stored at the right temperature, avoid reheating, and check the use by date. It's important to keep raw and cooked foods apart and wash thoroughly fruits and vegetables and salads. There are some foods that you should avoid. This is because it might carry harmful bacteria. This food includes things like shellfish, poultry, eggs, and also unpasteurized dairy products.
I was given a lot of advice during my treatment about how to prevent infection. Because my treatment happened during the COVID-19 pandemic, a lot of more restrictions were in place, so going outside with face masks on, staying away from people, and generally just staying away from people that were feeling unwell. Another big piece of advice that I was given by the hospital was to monitor my temperature. This was at the beginning of the day and at the end of the day, and continuously monitoring this to check in case my temperatures went up, and also just keeping an eye on any general symptoms where I felt a bit unwell. I was also advised by my hospital to take a lot of caution when it came to my meals.
Neutropenic sepsis is blood poisoning that happens when the white blood cells are low. During this time, a minor infection can become serious and potentially life-threatening. Symptoms of neutropenic sepsis include a temperature above 37.5 degrees Celsius or even a low temperature of less than 36 degrees, having symptoms of infection, or feeling unwell even with normal temperature. Contact the hospital with the number you've been given if you have any of this. It does not mean you have neutropenic sepsis, however, it's important to have it checked out. For more information, visit macmillan.org.uk or call the support line on 0808 808 0000.